Hey, this is Doug Fields, CEO of the Institute, along with my co-host Brent Macy, Managing Director, and welcome back to this segment of Healthcare Consumerism Radio. You know, not only is there a lot of innovation taking place, but a lot of innovation taking place around helping consumers make more intelligent decisions on their health plan choices. What is, for the first time, a very complex, decision-making process. And joining us to talk about what they're doing to help consumers in that decision-making is Stephen Warwick, CEO of Health Decisions US. Stephen, good morning.
Hey, good morning.
Hey, thanks for joining us, taking time to join us today. Good to have you with us.
My pleasure. I really appreciate the chance to talk to you, sir.
Hey, Stephen, can you give our audience a little background on Health Decisions US, and then we'll get into some specifics, but tell our audience what you guys are doing and, where you originated from, et cetera.
Yeah, certainly. Our company was started about a year, maybe a year and 3 months ago, as people were starting this process of trying to figure out what was going on with healthcare.gov, really. Okay. And everybody that was involved with this recognized that although healthcare.gov looked like the problem was in just using the site, once people really got down to the process of trying to choose health plans, that was the place where the real rubber met the road, and it was very difficult for people to do so. And we recognized this problem and recognized that in reality there are ways of simplifying how you can go about looking at health plans and making good decisions on how to distinguish between them.
Yeah.
And so we just began a process of developing technology around that, and that's essentially where Health Decisions started.
Stephen, I like your analogy to health insurance, remarkably similar to investing in a mutual fund. Talk to our audience a little bit more about what you mean by that.
Yes, this was actually kind of the light bulb that motivated us to develop the technology that we did was recognizing that essentially you're making an investment in a product which you're hoping to essentially minimize your costs moving forward, which is the same essential analysis as you're doing when you're trying to put money into a mutual fund or a stock fund and trying to maximize your amount of return. And in those particular cases, what you see is, an interest in increasing your return or increasing the value of your investment and minimizing the risk you have to uncertainty, and of course minimizing the management fees that are associated with the cost of doing business, essentially. And remarkably, those same concepts apply when you're thinking about buying health insurance or, frankly, any insurance policy, which is what do you expect in terms of the minimizing of your out-of-pocket expenses moving forward? What's your exposure to risk, which in the health domain is really what's your exposure to cost sharing and the implications to that, and then what are your management fees, or what are the implications of premiums on your costs associated with buying the insurance policy in and of itself.
No, Stephen, this is Brent. When you kind of looked at developing your technology platform, what did you see as some of the main problems facing consumers when they were making these health insurance decisions on their own?
Oh my God! I mean, when you look at a plan and the plan details and all of the different parameters that are necessary to trade off, it really is an intractable problem. It's something that you just can't keep all the numbers in your head. And for folks I've talked to in the industry that are even very experienced with this, they can spend many, many hours trying to make decisions just on the financial basis alone of which plans are actually the most economically valuable and the ones that meet their risk profile. And what's been interesting is that a lot of folks have looked at these decision tools in the past, and there's been discussions about how do you present this concept of exposure to risk. And in our case, we just said, look, give people what they really want to know, which is how much their out-of-pocket expense might look like for the upcoming year, and also give them some real numbers on how cost sharing can affect them.
Mm-hmm. Now, when you look,
I'm sorry, go ahead.
No, well, when you look, also you got this big emergence of these private exchanges out there, and some that could be tied to a defined contribution model. What about if that is, what an employee consumer is faced with? Is that a different set of decisions that they need to make?
I don't think so. I think that as we move forward, this concept of having to make decisions between different plans, both inside and outside companies, it comes down to the same fundamental questions of what am I getting for my money and what's my exposure to risk. And my expectation is that this kind of concept can translate into pretty much any of these decision scenarios.
Stephen, where has technology advanced itself around decision support to enable this to be executed?
The real opportunity here came from some really interesting kind of confluence of events. One is that finally the ability to get a complete compilation of all the plan parameters, the underlying plan design parameters in a common data format that can be used for analysis. The other one is the ability to identify appropriate actuarial models that are really designed for people that want to be able to assess what their actual out-of-pocket exposure is going to be. And then the computational power that enables us to run these models in real time. All this has come about really for the first time, which is what has enabled us to build this tool.
Mm-hmm. What is your current business model? What's the business model for your solution?
What we've been looking at really initially was providing this as a solution that could be integrated in with other people's products. I mean, getting into the business of providing an entire exchange or sales process initially really wasn't what our interest was. Mm-hmm. And so what we became more interested in was saying, okay, here we can provide a point solution for a decision process that is really unique in the industry, and by doing so provide something that can be integrated easily into other people's technologies, and by doing so kind of in an API format where the user interface would be completely defined by the tool set that this is being integrated into. And so that was our original approach, and recently we've been highly encouraged to come up with something that's a little bit more user-friendly and more consumer-facing so that we can go directly onto people's websites for providing these kinds of solutions.
I'm sorry, Stephen. Are you looking directly at exchanges and health plans as your ultimate customer, all the above, or what is?
Absolutely. I mean, this is something that could easily fit into a state exchange or private exchange. It easily shows something that can show up on a carrier's website. Even carriers have between 30 and 50 plans that people can choose from.
Mm-hmm. They do. Yeah.
So, it's an easy fit for those kinds of those opportunities.
Now, Stephen, when you're talking with your channel partners or your end customer, how do you evaluate the ROI with them with this type of solution?
That's a really good question. I mean, the ROI, there's really two different ways that people look at these things. One is from a pure convenience perspective, which is to say how many more people are going to sign up for health care if they don't need to understand, 20 parameters of every single health plan they're looking at. So from just a success process, people look at that. The exchanges look at that and say, okay, what's the incremental number of people that we can get to sign up, and how much is that worth to us? And then, for folks that are in the business of selling insurance like online and the rest of it, it's all a matter of increasing the number of transactions. And so there's an incremental revenue opportunity there. You can price based upon that opportunity.
Stephen, is this in place right now? or if not, when is it rolling out?
Oh, well, the tool is actually operational with a kind of a nice demonstration API on our website. You can just go on to Health Decisions US and see it in operation now. But it's the interface that's there now is more for demonstration purposes. It's not. Although I will say we have had it out there and had consumers looking at it and had some interesting results. But really, the intent is for it to be integrated in with other people's UI infrastructure.
And Stephen, as you know, this healthcare space is moving so fast, and you got private exchanges, you got public exchanges, you even got employers that are moving to full replacement plans. Health plans are trying to figure out what they're doing as well with their solutions. Where do you see this type of technology evolving, let's say, between now and 2018?
Well, initially, we have to have a much better and more straightforward way to solve the problem of just initial for consumers to buy plans, and that's got to show up both inside companies and on the individual public-private exchanges. And then, from this, you can expect that, people will be really talking about the concept of portfolio planning. And this is actually something that turns out to be really interesting is that, many times people buy health insurance, they're not just buying that, they're buying 2 or 3 other supplemental plans for either drugs or long-term care. And tools like this, in particular ones like that do this kind of modeling, can actually do this kind of multi-plan analysis so that one can truly see the impact of looking at an entire portfolio. And I'm expecting that's going to be kind of the way things are going to go in the future as well.
Well, Stephen, we really appreciate you joining us on the program today. Let our audience know how they can find you.
Just go to Health Decisions US, and that's different than other health decision sites. This is healthdecisions.us, and you can reach us through that. And we're very much looking forward to talking to people about it.
All right, Stephen, thank you so much for your time today. You have a great weekend, and to the rest of our audience, stay tuned for the next segment of Healthcare Consumerism Radio.
Solution providers, are you aware of the Institute for Healthcare Consumerism's multiple marketing platforms? You're invited to get a little closer to IHC with our Solution Provider Membership Marketing Program. Through IHC's exclusive Solution Provider membership, your business gets an all-access pass to engaging your prospects. This membership embeds your business within the Institute, which immediately aligns your company, its solutions, and your key executives with the nationally credible IHC brand, and shows your support of the healthcare consumerism movement as a market-wide solution. And that's just the beginning. Contact IHC's Managing Director, Brent Macy, today at bmacy@theihcc.com.
Hey everybody, Brent Macy, Managing Director for the Institute for Healthcare Consumerism, and it's that time again. I want to make you aware of IHC Forum West, November 10th through 12th at the Red Rock Casino in beautiful Las Vegas, Nevada. We do have $99 Super Saver rates now available. Visit our website, theihcc.com, to register.